All right. Hey everyone, my name is Kalen Powell. I'm one of the owners and founders at Apex Performance Wellness and Rehab. I'm sitting directly across from Dr. Adama Diarra of Pacific Concierge Physician.
That's right.
His website is My1PCP. He's doing amazing work. I'm here because we've recently partnered and have a good relationship with mutual patients, and I wanted to really highlight what he's doing on his side of the business. So if you could just introduce yourself briefly and give us a brief background of maybe your last decade or so in medicine.
Yeah, hi everyone. My name is Adama Diarra, like Kalen just said, and I'm an internal medicine physician, which is simply put as adult medicine that specializes in chronic disease management, urgent care, and really anything you make it. I graduated from med school in 2012 and wanted to do the full scope of medicine, meaning start the day with seeing patients in the hospital and the day with seeing patients in clinic. And I really, over time, loved all of it, but I navigated towards doing outpatient primary care because I had a lot more follow-up and getting to know people. Mostly when they were healthy and preventing disease, but also when they were sick, where it be urgent needs, where it be suture, where it be small little procedures or just acute illness. So all of that has kept me focused on my patients so much that I don't see myself doing anything else, that's me.
Yeah, so you opened your practice no more than 6 months ago, right?
Yeah, we actually officially opened our brick and mortar last month on the 19th. Mm-hmm. And we were online briefly before that for a good 3 months or so doing telehealth, telemedicine. Mm-hmm. But since this is open, it's really brought so much joy. Like people coming in, all these folks that I've been seeing for probably over 10 years, they started Googling and showing up. Some people just walk in. On the first day we're supposed to open, I was the only one here. No assistant yet, because I was just making sure things were in the right place for patient care. And people walked in, trying to establish care. I was like, we're not quite set up.
Right.
We don't have a patient room set up yet. We don't have a room bed or exam bed. But it's been great. Some of the same folks that have been seeing me at my old clinic, when the focus changed from not so much primary care, I decided to leave from there to this practice. They are now establishing care with me, and the word's spreading mostly from word to mouth because I'm honestly not doing a whole lot of marketing.
Right.
Yeah.
So. That's amazing. I mean, you have a beautiful space. When you walk in, it's really welcoming. It doesn't feel like so much as like a medical clinic, but it feels just like a good communal space where you have a couple people up front, you've got a couple offices, this open large window area that we're sitting in now. Yeah. Feels very welcoming. I'm sure your patients love that. Yeah. Who would you say that you primarily serve in your practice?
I think everyone. Really people who are health oriented that not only want to get better from whatever condition, but they want to prevent future flows. Those are the folks that I tend to see more because I spend a great deal of time explaining conditions. Yeah. I spend also time educating folks on preventing whatever illness that may be. So I find that people who are very health oriented that want to understand, okay, this is not the right path for me because of this potential risk, they navigate towards me. And a lot of my patients are middle-aged to young adults, but I also have lots of patients like 60 and older that they want to stay healthy for as long as possible. Then they come and see me.
Yeah, what kind of challenges would you say generally? What kind of challenges do you see most often, and how do you help patients overcome them?
Yeah, the biggest things that I see folks really grapple with in like medicine and internal medicine is when they come in because of the name internal medicine, healthcare, the biggest thing is that they're like, okay, well, I'm worried you're gonna put me on this medicine. Like a recent case, I had a patient who was a condition and I won't get into it because of HIPAA related things, but the first thing they mentioned to me when I interviewed them about the condition was that, well, you know, my last doctor told me about this medicine, but I don't want to do it because I'm thinking about, you know, working on it with this vitamin and that vitamin, and I'm just thinking, okay, what about your body's chance of taking care of it? What have you done with your body to help prevent this? So, like, what do you mean? Like, okay, let's scale it all back.
Yeah.
Let's go back to what you can do before you get to vitamin, before you get to the medicine, before you get to really anything. What can your body do to treat this thing? And this was a very highly educated patient who is a doctor in his own field, and he's like, where's the data? You know, so
How do you respond? Like, what do you say back to that? Yeah.
I pulled the beauty of this is you have time to spend with patients. So I pulled out meta-analysis studies, meaning not only one study there, another study there. You look at a combined accumulation of studies that have essentially proven one thing or another based on the evidence, and it's like, thank you, I'm really touched you showed me this, and I'm thinking, yeah, this is where you want to start. And
Yeah.
if that fails, then you can go with more vitamin, which is quite honestly sometimes experimental, and if that fails, you're looking at medications.
Yeah.
That's where we're throwing the kitchen sink at you. He was very, very understanding, and he said, okay, I hear you, I'm gonna try this out, and that's mostly what I do.
Yeah.
So
Yeah, I love that. I mean, that goes in line with a lot of our philosophy of what are you doing for yourself? Like, how can your body manage this illness or whatever you're dealing with? Having almost a foundation, almost like a triangle or a pyramid.
It really is.
Foundation, what are you trying to do and allow your body to heal? And then if not there, let's move to vitamins, minerals, all those things, and then we can move to medicine and throw the kitchen sink at it.
Yeah.
I love that philosophy, and it's great that you're just educating and have the time to educate people when you're sitting in an office with them, just to go over, spend some time so they can actually absorb what you're teaching them, and then obviously taking it day by day, week by week, month by month with them. Yeah. I thought that this was such an important relationship for Apex because over the years, which has been about a decade now, that we've been seeing physical therapy patients, DEXA patients, other wellness tests, RMR, VO2, and then just our fitness community.
Yeah.
We've been asked a lot about like, who should I go see for do you have any like a primary care that you would recommend? And I typically, like my dad being an ER doctor, he was my primary care, and I was just kind of like, hey, he's like, okay, you're fine.
Yeah.
But as I've gotten older, I've realized how important it is to have someone that you can really rely on and trust to be your primary care, because there's going to be a lot of things that come up that you just want to have answers for, or at least someone to go and discuss these things with and have a plan with.
Yeah.
So that's the main reason that I'm sitting right here in front of you, is so that people can learn in the Apex community who's out there, and explain the concierge medicine for those that don't know.
Yeah, so concierge medicine, sometimes called direct primary care, but which is different in its own right. But concierge medicine was born out of really a long time ago. It's been around. Patients that needed the extra care, they needed doctors to be able to see them in their homes. They needed doctors to see them in their workspace or in the clinic, depending on the setting. Asked for that, and then doctors who could provide that, they really did. But in time it became clear, okay, the insurance model that we have in our healthcare doesn't really cover for this thing. So it turned out to be, okay, you do the concierge part where patients do pay either a retainer or a certain amount of fee for those extra things that the insurance doesn't cover. And then the physicians who are their doctor or their care providers deliver that as best as they can. Most of what I do with the concierge so far is direct primary care, and in time it will be a model where, okay, we have the insurance billing aspect of things, and then the concierge model is the extras that the insurance doesn't cover. So if you're gonna do for instance, a physical under Medicare, which Medicare really doesn't cover physical, the biggest insurance in the country, you happen to do it in their format. And most doctors will tell you this is really not helpful in terms of telling these patients about all of their metabolic conditions, all of their cognitive risk, or whatever it may be. When you decide to do yours, which means, okay, Medicare's annual wellness is helpless. It's not going to help me with your care. You do your own assessment of patients' health, where it be their metabolic health, their cardiovascular health, or their musculoskeletal physical conditioning health, and you decide, okay, I have these tests here, these markers that your insurance will not cover for, and I am going to do that to help you know more about your fall risk, your diabetes risk, your dementia risk. And based on that, we can make a plan to help avoid that storm ahead, or that potential storm ahead. Course correction, that's all it takes. And what I do is mostly based on finding a way to provide that extra service, and patients who are interested in knowing really find that it's helpful. And sometimes it's not for everyone. Some patients don't want to get to that level. But most of folks that come to me, which is, I'm biased because they already come to me, they love to know that stuff.
Yeah.
So,
Yeah. Yeah, you said course correction. I've used that a lot over the years. Of if you track things, and if it's not going right, course correct. If it's going right, stay the course, you know. And it's great that they have you to depend on for just the guidance that they need. So a lot of it does come back to them, right, and what they're doing in their day to day.
Yeah.
And
it's a partnership.
Yeah,
more than
exactly.
anything else. Really, like concierge medicine is a partnership.
Yeah.
I can sit there, recommend X, Y, or Z, and if the patients are not part of that plan and are not part of, okay, we're gonna do this together, my doctor's got my back in case things go, whatever direction. If they don't feel that they are going to get, part of this is for them, for their health, and they decide to partake on the journey, if that's not there, it's not gonna happen. You
Right.
can say whatever you want, it'll just be, okay, I hear you, see you next year.
switching gears a little,
Yeah.
you've referred some patients to us for general muscle weakness.
Yeah.
So what's the reason for prescribing and referring for that? What do you see that playing a role, if they can increase the general muscle weakness or decrease the amount of it? How does that play a role in their health long term?
So, I mean, we in internal medicine, we have all these theories and also models that really tell us about someone's risk of having a heart attack or someone's risk of having a fall. One of the common ones, let's just say get up and go test, which a lot of clinicians know, like how long it takes someone to get up without using their upper body. When you notice the amount of time they spent on that, you can say, okay, this patient is at a fairly high risk of falling, or a moderate, or this patient sprung right up like it was a spring chicken. There's no risk of falling. Based on that, you can say, okay, this person can benefit from having better muscle strength conditioning in their legs. That's just one such example. But if you go beyond into like things that can really tell you about their mortality or longevity risk, such as grip strength, there are ways to tell you, I have a patient here, they're very healthy right now, but I'm a little worried about how much muscle or conditioning they have, whether it be cardiovascular or just muscle strength. So 10, 20, 30 years from now, based on that patient's current studies, as time goes, you're gonna decrease muscle mass. And if they don't try to get better, by the time we're 80, it may just take that one fall.
Right.
And that's the end of it.
Yeah.
So with that in mind, I try to get my patients the ones that I've referred, who are essentially middle-aged, we really want to get this to be a lifestyle, and it's not just a sprint. You don't just get this, 10 pounds of muscle now and then be done. No,
Yeah.
that's great, but I want you to understand, you get into this so that when you're 80, you're still outrunning all the 80-year-olds out there.
Yeah.
So,
Yeah.
yeah.
No, that's great. I mean, the VO2 max is a thing that we test, and if it's at a certain level now, we know that it's going to be down here later because just with age. But there's things you can do to try and maintain it. And if you're doing those things to maintain it, you're going to prevent a lot. Who knows what you're preventing, but there's a lot of things you can prevent, or at least you're working toward preventing.
Yeah.
So do you, when patients come in, how much are you talking to them about fitness, nutrition, those things that they can do on their own, right? Like daily, because those are every day.
Yeah, it really depends. So most everyone get my spiel on nutrition and my spiel on getting exercise, and I actually tell people ahead of time that if you don't want to do that, you can fire me. Don't even come see me. I had a patient call last week that was hesitant. They wanted to come in. They said, we just want a doctor that does everything. You know, I was like, okay, I can deliver on that as best as I can, and if I can't, I'll tell you what I don't know enough about, because I don't know everything. And I said, okay, my turn to tell you what I expect you to do, and that's exercise. And I don't care if you can't walk, you're gonna crawl. If you can't crawl, you're gonna lay down there and do some core exercise. And
yeah, that's great.
if you don't want to hear that, don't come see me.
Yeah.
And they were like, okay. They canceled the appointment, and I expected it to.
Yeah.
But then they called back and they rescheduled, and I said, okay, now expectations are set. This is what I expect you to do, and you expect me to do a certain thing too, and that's totally fine. If someone is coming to me with the expectation that I will be prescribing X, Y, Z, all of their meds, and they're not gonna do an ounce of like lifestyle-based management of their health, we're probably not going to be a great fit.
Yeah, I love you just you're putting ownership on them and saying, well, we can work together. It's a partnership. This is what I expect of you, and then the patient expects some level of things from you to meet in the middle.
It really
I love
is. And it's never like the extreme, like where someone just wants you to do everything and they don't, but like it's a spectrum and it's a range where you kind of see, okay, we're starting to get at a point where we're relying too much on these meds. We're needing to dial it back just a little bit. And a lot of people understand that. If you have the time and you explain it, they're gonna, there's no way. I think in medicine, there's just bad ways of teaching and telling patients what they need to know. And we need to do better at that. Unfortunately, it's not gonna be better in the near future because of the time constraints we have in our typical healthcare clinics in terms of 15-minute appointments. And if you have one issue that's simple, works great. If you have more than one, you may have to reschedule and it'll take another 6 months, which that's sad. But, you know, what we're doing here is different. You take your hour of a visit and we go through 1, 2, 3, 4, 5 things, and then if you want to, you reschedule. The way I think of that is the way I studied at school. You know, if I had an exam once a year, then I'll study maybe 2 weeks before that exam once a year. Not even 2 weeks, I'm being generous, probably 1 week. But if you have an exam, you know, let's say every quarter, you study more often. If you have an exam every week, which we did in med school, we had a subject, an exam every Monday, sometimes two of them, and then that keeps you in the loop. If you don't study, you're gonna fail, and if you don't stay on top of your game, that will get you. And the pop quizzes too, which will also, that was a different way to keep you engaged. So the basic correlate that I make that with patient care is that if you tell someone, come do your physical, we'll only do it every January and you don't have to worry about me for the rest of the year, that's when they're gonna get in shape for it. If you don't do that and you say, okay, we're gonna do your physical and then I'll follow up with you next month to see some of the things we've talked about and how well you're doing, or maybe a couple of months depending on how much time they have, that person is gonna stay on top of that.
Love that,
and then you see them more often, then it's gonna get to more retention and they're gonna keep some of those habits you're trying to get them to. But if you're just speaking to someone every year, once a year for 15 minutes, good luck.
Yeah. What excites you the most about collaborative care like this in the for the future of your business?
I think, you know, In terms of me with the patients or me with like Apex or?
Oh, with you and your patients.
Oh, I love that we make plans together, and based on how things turn out, really like the most exciting part, or at least the most, I want to call it, I just feel grateful. So patients that do their thing and they see the results, and maybe we prevented one thing or another, or they stay healthy, that honestly just, that's what I do this for. So if someone can keep a heart attack or a hip fracture or diabetes, which is associated with X number of cancers, that makes my day. Like,
Yeah.
that's all I really care so much to do this for. If I am failing at that, that's probably my most, okay, if you want to call me anxious, that's when I'm like, okay, I'm not avoiding this next thing, and that's where anxiety comes into me, because I see it and I'm just, this is avoidable. How can we not see that coming? And then a lot of the time, when I see that and I'm talking to the patient, I literally nag at them, and they either accept, or I'm the nagging doctor that they sometimes will listen, but I think even if it's 10%, something sticks.
Yeah, that's great.
Yeah, I've never met a patient who didn't take something away from my nagging, so to speak. Yeah.
Keep nagging.
Yes.
If someone wanted to schedule with you, best ways to call?
Best way is to actually get on our website,
Which is?
PacificConciergePhysician.com. You can also get there by using my1pcp.com, and you go to our new patient site or new patient enrollment, which is under booking on the tab there. And once you go through that, we'll reach out to you. If you don't want to do that, you can just call us our clinic number 503-664-1207, and we'll be here.
Yeah, and they're just, for anyone watching, Apex is not even 2 miles away from here, so we're really close. It's in Tigard, great highway access just off of I-5 and 217 right around Cruise Way on the 72nd Ave exit. So I really hope people watch this. I hope they see, or at least give you an opportunity to help partner with them in their health, because I think what you're doing here is amazing. So thank you for sitting down with me.
Thank you for your time. I really appreciate this.
Of course. Ooh.